Good afternoon. We will now start. I'd like to welcome everybody to this pep talk this afternoon. Please mute yourself, but always show your video picture. Sign in your name, your Facebook account, or email address in the chat box. Please include the names of companions attending with you. Use the chat box to ask questions and make comments while the pep talk is on. There will be group pictures at the start and end of the pep talk. Please show your face in the video. Another reminder, please take the online learning cum evaluation test exercise for mastery and have a perfect score to get a certificate. The link has been placed in the chat box. This is the picture of the certificate. Another reminder, 50 OLETE certificates will entitle one mentee to a free voucher for a ROJoson telemedical consultation. I'd like to request you to give feedback to this pep talk. Please type in your feedback in the chat box during the open forum and before we adjourn. Let's now have a group picture taking before we start the pep talk proper in 2 minutes. Okay, please show your picture, your faces. Ready? 1, 2, 3. I have a patient empowerment program in which I like to empower the lay people or patients to take control in the management of their health. I started the pep talk on May 15, 2021. There are 3 courses in the pep talk. I completed the core course on October 9, 2021. From October 23, 21 onwards, I have been tackling health disorder and health issue courses. This may take 3 years or longer depending on our enthusiasm, discipline, and perseverance. My pep talk today is entitled Dengue Awareness in consonance with the DOH's Health Awareness Calendar. So June has been declared by the DOH as the National Dengue Awareness Month. The empowerment objective for this pep talk is for the lay people to have an essential understanding of dengue in their health management. The contents of this pep talk will be the following. When and what is National Dengue Awareness Month in the Philippines? What is the current disease burden of dengue in the Philippines? What is a dengue? How is a dengue virus transmitted? How to avoid and control dengue infection? What are the usual symptoms of dengue? What are the clinical categories of dengue? What is the dengue case classification and level of severity? What are the phases of dengue infection? What are the diagnostic tests for dengue? What are the treatment for dengue? Is there immunity from dengue? Is there vaccine against dengue? And what are my patient empowerment advice on dengue? Let's start with the first topic. When and what is the National Dengue Awareness Month in the Philippines? National Dengue Awareness Month is observed every June by virtue of a proclamation by then the President Fidel Ramos. Dengue has been considered by the Department of Health as an all year round. So every month, all year round, there is a dengue incident, okay, which rises in incidents, meaning increase in the number during the rainy season due to the presence of more breeding places for the disease causing Aedes aegypti type of mosquitoes. This is the most common type of mosquitoes, kind of mosquitoes causing dengue. So rainy season in the Philippines, as we know, usually starts in June. So we're now in the month of June. And this is the reason why June has been selected as the National Dengue Awareness Month. The purpose of the Dengue Awareness Month will be to raise awareness among the citizens on the importance of prevention of dengue and educate them on how to manage so as to reduce the morbidity, mortality from the disease, to strengthen the National Dengue Prevention and Control Program, thereby reducing the morbidity, mortality, and social and economic burden generated by the dengue outbreaks and epidemics. So these are the two main reasons why we have this National Dengue Awareness Month. To address the dengue problem, the Philippine government established the National Dengue Prevention and Control Program in 1993. This is still in place. The programs consist of case and vector surveillance. A case means the patients, and then the vector meaning the mosquitoes. Case diagnosis and management, integrated vector management, outbreak response, if there's an epidemic or outbreak, health promotion and advocacy, and research. What is the current disease burden of dengue in the Philippines? Dengue is the fastest spreading vector-borne disease in the world, endemic in 100 countries. So it's not only in the Philippines that we have dengue, but it's also seen in 100 countries all over the world. So it's the fastest spreading vector-borne. Vector-borne means there's a mosquito carrying it. Okay. In the Philippines, these are the data from 2016, 2012, and 2016 data. The 5-year average cases of dengue is around 185,000. Okay. That's the average. And then the 5-year average death is 732. So 700 persons are dying from dengue every year. And then the 5-year average case fatality is 0.09%. Okay. So the incidence rate of dengue was highest among children 5 to 14 years of age, with over 80% of dengue-related death occurring among individuals less than 20 years of age. So dengue is more commonly seen in the young children and is causing death in this age group. Now, this is a statistic in 2000, published in 2023, but the data is on 2022. Okay. So there were over 220,000 dengue cases recorded in 2022 compared to 78,000 in 2021. So you can see that there is a 182% increase in the incidence, okay, in 2022. There were 722 deaths in 2022 versus only 282 deaths in 2021. So laki ang discrepancy and increase na, in terms of number and also in terms of death. So usually the Philippines and other countries report to the WHO on their monthly incidence of dengue in their country. So for the Philippines, as of April 29, 2023, a total of 39,000 cases have been reported already. Okay. The number of cases is 43% higher compared to the same period in 2022. Dengue is present nationwide, as well as I said, it's present in 100 countries in the world. But in the Philippines, it's present nationwide, all over the regions. In 2022, these are the three most common regions that have dengue: Central Luzon, number one, National Capital Region, and then Calabar Zone. And most of these dengue cases are seen in children. Now, as to the death from dengue, the most common regions that reported most death are the following: Central Visayas, Central Luzon, and Western Visayas. Again, death occurred mostly in children. Dengue is a national health problem. It is endemic in the Philippines. It can cause death. Though affecting mostly children, it can also affect even adults. Though adults have died from dengue. So with everybody's help, we have to reduce the morbidity, mortality, and social and economic burden generated by the dengue outbreaks and epidemics. What is a dengue? Dengue is a viral infection caused by the dengue virus, transmitted to humans through the bite of infected mosquitoes. So the kind of mosquitoes which are notorious for this dengue are the Aedes aegypti. This is a picture of the Aedes aegypti. I don't know how, I myself do not know how to recognize the different types of mosquitoes because they're too small. Okay, but the other type of mosquitoes is the Aedes albopictus. This is another type which can cause dengue, but mainly Aedes aegypti. There are 4 serotypes of dengue virus: dengue virus 1, 2, 3, and 4. So the first infection with one of the 4 serotypes usually is not severe or asymptomatic, while the second infection with one of the other serotypes may cause severe dengue. Okay. So remember that there are 4 serotypes of dengue. Okay. So usually, if you have one infection with dengue, you can have immunity from it, but there's still three chances that you can get dengue with dengue 2, 3, and 4. How is dengue virus transmitted? It's a human to mosquitoes to human cycle of transmission. Okay. So dengue virus circulating in the blood of humans ingested by the female mosquitoes during feeding. The virus then infects the mosquito mid-gut and subsequently spreads systematically over a period of 8 to 12 days. Okay. The virus can be transmitted to other human beings during subsequent probing or feeding. Thereafter, the mosquitoes remain infective for the rest of its life until the mosquitoes die. So dengue virus is transmitted by day-biting Aedes aegypti principally and Aedes albopictus mosquitoes. The Aedes aegypti mosquito breeds in clean water, which are accumulated in containers such as flower vases, tires, mga gulong, okay, yung mga lumang gulong, bottles, and cans. Those containers can be the breeding places of mosquitoes. Usually, these containers could collect water, especially during the rainy season. To prevent the spread of dengue, do the following measures: cover all containers used in storing water, change water in flour bases every 2 days as much as possible. Clean and rub the edge of water containers to remove the eggs of the mosquitoes. Drain the water from the gutter. Make a hole in the tires. If you have old tires in the backyard, put holes in the tires to prevent collection of water. Collect and throw bottles and cans that are possible breeding places of mosquitoes. Other preventive measures would be to use self-protective measures such as wearing long sleeves and pants, and then using mosquito net and mosquito repellents as much as possible during the dengue rainy season. So prevention and control, seek and control the breeding places, secure self-protection, seek early consultation if you have symptoms of dengue, and then just support the spraying to prevent impending outbreaks. What are the usual symptoms of dengue? It's a disease entity. Dengue is a disease entity with different clinical presentations and often with unpredictable evolutions and outcomes. So different clinical presentations, that's why it may be difficult to differentiate it from the other viral infections like COVID and also flu. It may be difficult to differentiate. So there are two categories, general categories of clinical categories of dengue. One category is asymptomatic dengue. You may have dengue, but you don't have symptoms. Just like in COVID, you may have COVID, but you don't have symptoms. And then the symptomatic dengue, you have symptoms already, and the symptoms can be classified into mild, usually the so-called dengue fever, and then the severe one, which can come in the form of dengue hemorrhagic fever and dengue shock syndrome. An overwhelming majority, 75 to 90% of patients acquire dengue without any symptoms, not even fever. We don't recognize it. Okay? If it's asymptomatic, we cannot recognize it. Dengue is sometimes referred as to the breakbone fever because of the severe muscle, bone, and joint pain it can cause. So this is the hallmark of the dengue. Masakit na masakit ang muscle, bone, and joint pain. So here, the diagram that shows the dengue infection, virus infection can be asymptomatic or symptomatic. There's asymptomatic, pwedeng those with undifferentiated fever, hindi mo malaman kung anong causes. But it can be caused by dengue, but it doesn't have a typical presentation. Then you have the dengue fever syndrome and then the dengue hemorrhagic fever, which is more severe. Okay, this is also a more severe type of dengue. Expanded dengue syndrome, isolated organopathy, and unusual manifestations. Okay, so dito sa dengue fever syndrome, there are two types. Okay, so you can have hemorrhages without hemorrhages, and then with unusual hemorrhages. Okay. And then here, more severe type, wala pang shock, but here you already have shock syndrome. So iba-iba yung extent of the disease of the symptoms of the dengue. What are the usual symptoms of dengue? Usually it's non-specific, but it's usually consists of the following: sudden onset of high fever, which may last from 2 to 7 days, joint and muscle pain, and pain behind the eyes, weakness, skin rashes, nose bleeding when fever starts to subside, abdominal pain, vomiting of coffee-colored matter, dark-colored stools, and difficulty of breathing. So maraming symptoms, but so it's very non-specific. So just remember the 7 usual symptoms of dengue. Fever. Pag may fever, usually one of the suspect is a dengue, aside from COVID, aside from flu, and also other types of infection, non-specific ones. And then muscle and joint pain, as I said, this is a hallmark of the symptoms of dengue. Then skin rashes, and then bleeding nose and gums. Ito yung lumalabas ng mga hemorrhagic type of dengue. And then the others are very non-specific: vomiting, diarrhea, and headache. So probably just remember these four for you to suspect strongly dengue: fever, muscle and joint pain, skin rashes, bleeding nose and gums. What is the dengue case classification and level of severity? This is the classification used by the DOH and also by the WHO. So dengue disease case classification, you have the dengue with and without warning signs. Okay, this category is without warning sign, and this is a subset with warning signs. And then it can progress to severe dengue. And then there are three categories here: severe plasma leakage, severe hemorrhage, severe organ impairment. So by level of severity, it's classified as dengue without warning signs, medyo mild pa. Then dengue with warning signs, medyo nag-advance na. And then severe dengue. Dengue without warning signs can further be classified according to signs and symptoms and laboratory tests. And then they are classified into suspect dengue, probable dengue, and confirmed dengue. So when you say suspect dengue, it's a previously well individual with acute febrile illness, fever, 1 to 7 days duration, plus 2 of the following symptoms. Kung meron kang 2 of the following symptoms plus the fever, then we call it dengue suspect already. Now, probable dengue, there must be a suspect of the dengue plus a laboratory test. The laboratory test usually being done is dengue NS1 antigen test and at least a CBC just to check if there is leukopenia, or leukopenia means below the normal count of the white blood cells. And with or without thrombocytopenia, meaning the platelet count, okay? Or another test that can be done is the dengue immunoglobulin M antibody test, but this is optional, okay? Now, when you say you have a confirmed dengue, so the patient must have these positive results on any one of these complicated tests. These are all expensive tests: viral culture, PCR, okay, like reduction, neutralization prints. So medyo mahal ito, but these are the ones that, so majority of the patients that we have now, when we suspect dengue or probable, up to probable dengue with a confirmed laboratory test like the rapid dengue test, NS1. Now, dengue with warning signs, meaning a previously well person with acute febrile illness, 1 to 7 days, plus any of the following. Okay. Meron na siyang abdominal pain, more severe na, persistent vomiting, clinical signs of fluid accumulation like ascites, edema, then meron siyang bleeding tendency, lethargy and restlessness, liver enlargement, increase in hematocrit, and decreasing platelet count. So ito yung warning signs na. So this shows the importance of close monitoring of all patients with dengue, especially from those with mild dengue. Then you observe ninyo kung magpo-progress into more severe dengue. Now, severe dengue, there are 3 categories: severe plasma leakage, and then severe bleeding, and severe organ impairment. So what are the phases of dengue infection? The first phase, usually the febrile phase, may fever. The second phase is the critical phase. And then the third phase is recovery phase. Okay? Sana umabot sa recovery phase. Okay? So when you say febrile phase, it usually lasts from 2 to 7 days. There are some hemorrhagic manifestations like bleeding, Okay, monitoring of warning signs is crucial to recognize its progression to critical phase. Pag dumating na sa critical phase, na meron ka ng itong mga symptoms na more severe, and then after that, the outcome here, it's either the patient will improve or deteriorate, leading to death. Okay. Recovery phase happens in the next 48 to 72 hours, in which the body fluid goes back to normal. Yung mga severe warning signs ay bumabalik na. Okay. So the general well-being of the patients improve. The classical rashes, they have some classical rashes like this. May mga puti-puti and then red ones. And then the white blood cells in the blood test usually starts to rise soon after the fever has subsided, but normalization of the platelet count typically happens later than that of the WBC. What are the diagnostic tests for dengue? So, as a starter, dengue virus testing is not recommended for asymptomatic patients and preconception screening. So, hindi naman natin alam kung may dengue pasyente. So, we don't usually use this screening test. Patients with symptoms consistent with dengue can be tested with both molecular and serologic diagnostic tests during the first 7 days. Importante yung the number of days during the symptoms, start of the symptoms. So after the 7 days, the test only with the other types of tests, serologic diagnostic tests. So here, nakita niyo importante yung symptoms. Less than 7 days, you can use this type of test. Then more than 7 days, you cannot use these two types of tests, but you can use the other tests. So these are the common tests being done. Dengue NS1. Okay. So the rapid dengue test. So it's requested between 1 to 5 days of illness. Okay. So used to detect the dengue virus antigen during the phase of acute infection. And this test is free in all health centers in selected public hospitals nationwide in the Philippines, supposed to be. But there are private institutions that offer this. So usually it costs about 2,000 something, 2004, 2008. Okay. Then you can have this test also, IgM, IgG. Okay. And then the other test that usually done to help make a diagnosis is to have a CBC, in which we look at the WBC, the platelet count, and the hematocrit. Okay. So we look for the trends in the decreasing WBC, decreasing platelet, and increasing hematocrit. If these are present, then we most likely the patient is probable dengue. Other more expensive tests, which are not commonly done, but it can be done in higher centers, which are very expensive, PCR, okay, and others. So what are the diagnostic tests that commonly being done in the Philippines? NS1, IgM, IgG, or this rapid combo test, okay, so which you can be gotten within a few minutes. Okay. There are a lot of self-test kits in the markets which are cheaper, but this need to be done with guidance. Okay. Okay. So you can order it from the internet, but this has to be guided by the physicians. So the self-test kit, just prick your finger to have some blood, and then put the blood in that particular examining kit, just like in COVID, there's a plate there, but in COVID you don't use blood, okay? And then you look, you interpret whether it's positive or negative. So these are some of the samples. I'm not advertising, but showing you the samples of the rapid tests that can be bought in the market. What is the treatment for dengue? There's no specific medicine for dengue and severe dengue. We have to remember that. No specific treatment. So everything that will be done for dengue and severe dengue is just supportive. Okay. wait for the body to recover. So symptoms of dengue can be mild and severe or severe. Mild symptoms can be treated at home, whereas the severe symptoms should be hospitalized. If you get a dengue, so these are some of the initial things that you have to do. It's important to rest, full rest, drink a lot of fluid, use acetaminophen or paracetamol for pain and also fever. Okay. Avoid using the non-steroidal anti-inflammatory drugs like ibuprofen and aspirin because this can cause further bleeding. Okay. Because we're in dengue, there's a tendency for bleeding to occur. Then it's important to monitor closely for severe symptoms that may happen, that may occur, and then contact your doctor as soon as possible if you notice any. So in dengue, we don't give, since dengue is virus, we don't give antibiotics. So essentially, it's just rest, drinking a lot of water, paracetamol for pain or fever, and then watch and wait. So these are the who are the patients who may be sent home. We don't have to be, so not all patients has to be hospitalized. So not because a lot of patients worried about dengue, they want to be hospitalized. No? So this is a infographic that will tell you that not all patients with dengue need to be hospitalized. So, but who are these patients? So these are the patients who are able to tolerate adequate volumes of oral fluid, meaning the patient can eat, can drink a lot of water, so they don't have to be hospitalized. Then the patient is passing out urine every 6 hours, maraming ihi lumalabas, that's good, and do not have any of the warning signs, particularly when fever subsides. And then have a stable hematocrit. Kung nagpa-CBC siya, have a stable hematocrit. No? So pwedeng sa bahay lang. Ensure that they get a lot of rest, give them plenty to drink, have them rest or sleep under a net and wear a repellent. Na, parang di, kasi pag may dengue siya, pag kinagat siya ng mosquitoes, yung mosquitoes magkakaroon ng dengue virus, and then that infected mosquitoes will transmit to your relatives who lives with you nearby. Okay. Then the other measure here is that you can give paracetamol for the fever and headache and other pains. Okay. And then learn the warning signs of severe dengue. So if the signs are present, go to the hospital already. Okay. And then while taking care of other people with dengue, take care of yourselves, use repellent, and wear light clothes that cover most of your body. So these are the advice of the WHO. Patients who should be referred for in-hospital management, kung sino dapat pumunta sa hospital. So if there are warning signs, there's no warning signs, but there's a coexisting condition that may make dengue, and it's parang tinatawag na comorbidities. No? Okay, baka lumala. No? So social circumstances as living alone or living far from the health facility and without a reliable means of transportation, yung malayo, nakatira, the referring facility has no capability to manage dengue with warning signs and symptoms. Yung malapit na hospital, wala. So baka kailangan admit na in preparedness for the possible worst scenario, baka kailangan na i-admit sa isang hospital. Now, those who needs admissions, yun talagang kailangan na i-admit sa hospital, yung mga with severe plasma leakage leading to dengue shock or fluid accumulation with respiratory distress or difficulty, yung mga signs and symptoms of hemorrhage, hindi nadugo na, and then severe organ impairment like liver damage, renal impairment, cardiomyopathy, encephalopathy, etc. So the patients in this group C should be immediately referred and be admitted in the hospital within 24 hours. Okay? Very critical kasi ito. Okay? So is there immunity from dengue? Are there vaccines against dengue? Recovery from infection by one dengue virus provides a lifelong immunity against that particular virus serotype. As I said, there are 4 serotypes, dengue 1, 2, 3, 4. So kung na-infect ka na by one virus, meron ka ng lifelong immunity. Pero meron ka pang 4 na pwedeng tamaan. Na? Okay. However, this immunity confers only partial and transient protection against subsequent infection by the 3 other types. So pwede ka pa rin tamaan ng dengue with the other 3 serotypes of dengue virus. As to the vaccine, as we know there, we have heard about the dengue vaccine, which caused a lot of controversy before the pandemic. Okay. So, but there is a vaccine really for people who had dengue at least once and live in places where the disease is common. Then you can give this one, dengue vaccine. So what are my patient empowerment advice on dengue? Number 1, beware of dengue infection. Don't take it lightly. Okay. Majority are mild, but some may be fatal. So avoid mosquito bites as much as possible, kung kaya, pero imposible, di ba? Remove breeding places of mosquitoes in your home and in the backyard. Ito pwedeng gawin, no? Just be vigilant in clearing up all those breeding places. At the moment there are symptoms suspected of dengue, rest and hydrate right away. Yan ang pinaka-importante. When it's suspected of dengue, it's hard to differentiate this also from COVID and other diseases. The treatment also for the others like COVID and flu is also rest and hydrate. So do this right away and then observe. Okay. So you may need diagnostic tests to differentiate the other types of, to differentiate dengue from COVID or from flu. Okay. And then the last thing, the most important thing to do after with the rest and hydration is to monitor yourself. So if with progression and warning signs, consult the physicians right away. Summary and takeaway, I have discussed all these topics. I won't read them one by one anymore. And then takeaway in relation to patient empowerment, be always in touch with reliable medical information on dengue. Knowledge is power, it gives power. Use the 4 Ks of patient empowerment: kaalaman, kakayanan, karapatan, and kapangyarihan to gain greater control over decisions and make better decisions on dengue issues in your health management. So with that, I end my pep talk. But before we go to the question and answer portion, as a reminder, please take the Olete 50 Olete certificates will entitle one mentee to a free voucher for ROJoson telemedical consultation. So feedback, please type in your feedback in the chat box. Okay. So let's now have a group picture taking before we start the question and answer and interactions. Okay, ready? Everybody is 1, 2, 3. Okay, the floor is now open for questions, comments, recommendations, consultations, pwede rin. Na? Okay. Anybody who wants to start?
Hi, Doc.
Mayan.
Doc, is there any difference between dengue and H fever?
H is
Yeah. Or are they the same? Because when I was in high school, I got this H fever, so I was thinking they are the same with dengue, but I haven't checked it yet.
I think so. Nakalimutan ko na nga rin yung H fever. Okay. So, as a dengue, usually, kaya nga yung term ngayon, before, a popular term for that is dengue fever or H kasi probably it represent hemorrhagic fever, di ba?
Ah,
Okay.
okay.
H is hemorrhagic fever, na? So,
Ah,
probably in the past, ginagamit nila the word H fever to refer to dengue fever. Okay? So,
ah,
over the years, nag-evolve nga. While I was researching on this topic also, napansin ko nga, it's better to use the word dengue infection na lang. No? So, under dengue infection, kasi pwedeng asymptomatic, di ba? So, walang fever. No? Ngayon, kung may fever, you can call it dengue fever, no? Na may symptoms of fever na and mild symptoms, no? Like headache, ganun, no? And then, kung meron na siyang manifestations of bleeding, like yung gums yan, nagbe-bleed na, gano'n, then you can call it dengue hemorrhagic fever, H fever. No? Okay.
ah,
So, yan ang evolution of the mga terms na yan. No? So,
okay.
currently, so we're using, the general term is dengue. Okay. Then after that, based on the symptoms, the status, is it dengue fever, which is mild, or severe? Kung severe, andun na kasama yung H fever, hemorrhagic fever. Na? And the other more severe is may shock na, and then hemorrhagic shock or dengue shock syndrome na pwedeng ikamatay ng pasyente. Na? Okay?
I have another question, Doc. Sorry.
Good, tama.
Uh, when I worked before in Africa, West Africa, some of my colleagues got malaria. So which one is more dangerous, dengue or malaria?
Alay ko malaria. Kasi
Ah,
majority of dengue nakaka-recover. No?
mm,
Palagay ko, malaria is more, if you compare the two, more, what do you call that? More severe ang presentation also, di ba? Kasi nag-chills na ano.
oh, Doc, yes.
Okay.
Ah,
So, pero may gamot kasi yung malaria eh, di ba? May mga gamot, di ba? May anti,
yes,
you know.
he got
Baka,
vaccinated.
baka ma-equalize niya in terms of which one is more dangerous, no? Kasi sa dengue, wala eh. So,
Ah,
walang gamot,
okay.
na? Okay.
Okay. Thank you,
Pero,
Doc.
pero majority ng dengue, nakaka-recover din, di ba? So, kahit na
Opo.
walang gamot, na? Okay. Basta importante, ang pinaka-importante doon, inom ng tubig marami. Inom ng tubig, tsaka rest, no? Okay.
Thank you so much, Doc.
Thank you. Thank you for those stimulating questions. Any more questions? Who got dengue already in the group?
Oo, Dok.
Ikaw? Kat? Kailan?
Yes po, nung first year high school ako, yung first batch ng dengue, isa ako sa nagkaroon.
Anong first batch? May
Yung
first
I
batch?
mean, yung unang bukso ng dengue sa Pilipinas.
Kailan yun?
Sabi na ng doktor ko, sa Veterans Hospital pa kasi ako na-confine ng doc. Tapos sabi niya, yung parang kasagsagan yata ng dengue, hindi ko na alam kung 1996 o 95, nakalimutan ko na, Doc.
1996, meron na dengue yun. Hindi first batch yun. Matagal na.
Hindi ko na, yun sabi ng doktor ko, hindi ko na, yun na naalala ko. Tapos, munti ka na akong salina ng dugo, Doc, kasi dumudugo na yung ilong ko.
Okay, dumudugo. Sige, kwento mo nga.
Tapos,
Kwento mo nga.
mababa na daw yung, naalala ko lang, Doc, kasi bata pa ako noon tawag dito, mababa, na parang lantang gulay na ako, talagang binubuhat na ako ng tatay ko. Tapos, mababa na daw yung platelets ko. Wala namang gamot, Dok. Inom lang ako ng inom na tubig.
Ilang taon
Tapos
ka?
naka-drip na. Siguro first year high school. First year high school ako noon, Dok, mga siguro 12 or 13 years old, ganun.
12 years old, high school.
12, opo, mga ganun, 12 o 13.
So, fever muna.
Opo, fever muna, umuwi ako sa bahay namin, may galing school.
Okay.
Talagang ang taas, pinahilot pa ako kasi syempre po, naniniwala sa ano. So, pinahilot ko pala may pilay, hindi pa rin nawala. Tapos, ang dumi ko, liquid na, as talagang, kala mo chocolate.
Okay, diarrhea. Okay.
O, diarrhea na po.
Okay.
In, ano yata, ay parang 3 times a day o ganun.
Okay. Sige, ano pa?
Ano, yung wala ka nang gana kumain.
Walang
Kahit
ganun.
Lucky Me yata, hindi ko na makain.
So, ilang days after nagkaroon ka ng fever, nagkaroon ka ng bleeding, gum bleeding.
Yung bleeding, mga 1 day lang, Dok. Kasi naitakbo kagad ako sa ospital ng nanay ko.
Hindi, yung pagitan, yung onset ng fever mo, kailan sumapit yung yung bleeding? 5 days? 6 days after?
Parang mga 3 o 4, hindi ko na maalala. Parang ganun po, Dok.
Okay.
Kasi 2 days pa ako sa bahay bago pa ako naitakbo Mga ganun, mga 2.
Ang
Pangalawa
bilis.
yata, pangatlong araw. Hindi ko na maalala
Okay, so ang bilis nag-onset ang bleeding mo, no? Okay, 3.
Opo.
So tinakbo ka na sa hospital, mababa ay kinuha na ka ng CBC, di ba? Okay.
Opo, tapos,
During
ang dami nilang ginawa, hindi ko na maalala, Dok. Basta parang, naalala ko na para akong lantang gulay na naka-dinaya-pera na ako kasi hindi ko na kayang halos pumunta ng banyo.
Okay, so you went to the category of medyo severe na siya, no? Severe, pero hindi pa naman siya critical, no? So nagkaroon ka ng bleeding, yung platelet mo, bababa ka mo, di ba? Okay.
Opo.
Yung so nasalinan ka ba ng dugo? Hindi na.
Hindi naman po, Dok. Muntikan na.
Swero lang.
Pero lang po.
Okay, hydration, hydrate, no? Okay. So, importante yung hydration eh. Then, a lot of times, mag-i-stop din continuously yun eh. Kasi importante yung Okay. So,
Dok, tanong ko lang, yung tawa-tawa ba, tsaka, kasi syempre ngayon na lang sumikat, tawa-tawa tsaka yung papaya ba, is effective?
hindi ko alam. Pero walang report on that. Baka yung mga practice ng mga natin, kanya-kanyang practice yun. Pero usually, it's not being recommended, na? Okay. Tawa-tawa, saka yung papaya, na? So, usually, wala, just rest lang. Then, yung tubig lang inumin mo, no? Okay?
Then yung Dembaxia, binibigay pa rin ba po ba nila hanggang ngayon? Actually, yung pamangkin ko na injection na siya, wala naman nangyari. Although controversial siya nung time nang nagkaroon ng vaccine ng Dembaxia.
Hindi ko alam kung nagbibigay pa sila ngayon, no? Because of the controversy. Pero internationally, recognized naman siya, pwedeng ibigay. Pero just like with any vaccines, maraming controversy, so it really lies on the people kung anong belief nila, no? Okay. Kung ayaw nila, susundin na lang, di ba? Kung gusto nila, well and good. So, just be aware of the pros and cons, no? And then kung ayaw mo mga vaccine, just make sure that that you try to prevent dengue as much as possible, no? So basically, mahirap i-prevent, pero just try your best, yung mga mosquito bites, no? And then yung mga breeding places, no? And then keep your resistance always as high as possible. Healthy lifestyle, exercise, drinking, no? Importante yung host resistance, na resistance ng katawan ng tao. No? Okay? Any more questions? Thank you, Kat, for sharing.
Okay.
Any more? Sinong may experience sa dengue? And then, I'm trying to see kung saan ang pinakamurang nagpa-test for dengue. I'm trying to explore, no? Anybody who have some inputs? Sinong nagpa-dengue test na dati? Wala. Swerte tayo. Wala pang nagka-dengue. Okay. Perla, na-dengue ka na ba? Pasqua? Wala pa. Unmute, unmute. Unmute. Unmute yourself, Perla. Okay.
Ah.
Okay.
Yung typhoid, doktor, pareho lang ba sa H fever yun?
Typhoid fever is different from H fever. H fever, pala ko, hemorrhagic fever yun dati, na? Okay. Yung
Oo.
typhoid fever due to salmonella, ano yun infection, na? Okay.
Typhus. Sa Tagalog ba yun? Yun ang typhus?
May typhus, may typhoid, there's another, not typhus, another viral disease nga, may typhus fever, no? Iba-iba yon, no? Maraming klase, no? Okay. That's why sabi ko nga, how do you usually fever, di ba? They have one thing in common, fever. Then after the fever, titingnan natin, anong nagkakos nun, di ba? Is it a viral infection? And then if it's a viral infection, what type of viral infection? If it's not a viral infection, what is it? Di ba? So, kaya ang aking tanong ngayon, how do you differentiate COVID-19? Kasi COVID-19 may infection, may fever din, di ba? Okay.
Opo.
And then, yung flu, may fever din, di ba? And then dengue, may fever din. So, at the moment, these are the three most common entities that may be difficult to differentiate. No? Okay. So ang aking suggestion is that you monitor yourself, no? And then, as I said, look for the pattern of diseases, pattern of symptoms, now that will most likely indicate that you have a particular disease. Example, if you have a fever and then may cough and colds ka, most likely it's either COVID or flu. Okay? Kasi yung dengue, usually, hindi kasama yung cough and colds. Diba? Okay. The other symptoms kasi yung mga headache, yung mga joint pain, body ache, all pareho sila Meron sa mga tatlong categories na COVID, dengue, and flu, di ba? Andun sila di ba? Okay. And then, yung pinaka-common symptoms also ng dengue is yung mga tinatawag na more specific ones that will indicate what will make you suspect dengue, yung bleeding tendency, parang kay cat, no? May bleeding tendency, no? So you suspect dengue, no? Pero kung wala kang bleeding tendency, wala kang bleeding symptoms, most likely it's just COVID or flu. Okay? So iwa-weigh mo lang, no? Okay. Just like
Bakit, doktor, hindi sila makagawa ng vaccine kontra dengue?
ewan ko.
COVID, meron na silang nagawa. Mas ano pa yan, mas late pa na nag-appear yung COVID. Pero yung dengue, matagal na po yun. Bakit hindi kaya sila maka-formulate ng vaccine against dengue?
Palagay ko magawa rin sila. Palagay ko. In due time. No? Okay. Okay. So, I don't know the reason why. Baka may maraming factors, yung mga economy, yung mga financial returns, di ba? Yung vaccines, no? So, COVID kasi maraming tinamaan, kaya nag-COVID vaccine na sila, nag-create sila. And then also there are a lot of financial returns by doing the vaccines, di ba? Okay, for COVID. No? Anyway, going back to the but meron ako sa pasyente ngayon, nagte-telemedical, may fever, may sipon siya on the first day, and then nag-cough, then fever, then 5 days na, hindi nawawala, sumasakit na yung mata niya, no? So, pero wala siyang bleeding, no? Masakit. So, 5 days na. So, sabi ko, sige, magpa-dengue titer ka na. Dengue, normal, no? Okay. So, lesson there, basta kung merong respiratory symptoms, most likely you don't think of dengue. Now you think of COVID or flu, no? Okay. Okay? Pag meron ka ng bleeding tendency, gum bleeding, at yung mga petechiae, rashes, yung rashes is a sign of bleeding na rin. No? Okay? You start suspecting dengue fever. No? Dengue. No? Okay. Then you have a test done. No? Okay? Now, between the two, actually, meron tayong test. If you really want to know, we have a COVID-19 test. You can also have a flu test. Kaya lang ang mamahal, di ba? You can also have a dengue test. You can do those tests, not to check what specific infections that you are carrying, na? Okay. Pero medyo magastos din 'yon, na? Now, there are also times in which two diseases can be present, pero rare, not so common. You can have COVID and dengue at the same time. Okay.
Pero doktor, parang palagi nilang minomonitor pag may dengue, kayong blood count ba? Pag bumababa daw, dengue.
No, hindi.
Oo. Yung white blood count ba yun?
Hindi.
Yung platelets pala ay platelets.
CBC.
Oo.
So they monitor through the CBC yung
Opo,
hematocrit.
yun yung palagi nilang minomonitor.
Yeah, hematocrit and also the WBC count and also the platelet. No? Yan.
Opo.
Yan ang clue. No? Okay. Pero let's say isang pasyente may possible dengue, ang pinaka-reliable diagnostic test yung NS1 or IgM. Yan ang pinaka-reliable, na? Okay. Pero kumisan usually mga 2,800, 2,900 pesos yan, Pero ngayon that's the most reliable, no? Kung lumabas ay positive, no? Then you can add CBC for monitoring purposes. For monitoring, kung pwede ka na sa bahay, nagpagamot, bahay, or kung mababa, baka kailangan mo magpa-hospital na, di ba? Then during in the hospital, magastos lang kasi they also monitor yung CBC mo every now and then, di ba? Every 6 hours, every 12, 24 hours, gano'n. So, while you're in the hospital, monitor, pero while you're in the hospital, magastos din, di ba? Okay, hindi libre yung hospital, na? Okay. So, yung sa CBC, monitoring for kung stable siya or bumababa. Kung bumaba na, kung tataas, recovery, di ba? Kung magre-recover ka, ganun. Okay? So dati wala yung mga specific test for dengue like NS1, yung mga NS1 or IgG, IgM. No, usually we use the CBC. IgG, immunoglobulin. No? Mga 20 years ago wala pa yan, yung during our earliest day, no? Ang ginagamit namin CBC. Then monitor.
CBC, complete blood count.
Okay.
Okay po. Thank you, Doctor.
Any more questions? 301, we still have room for one questions. Wala na? No questions in the chat box, Amit?
Nothing at the chat box.
So if there are no more questions, ano pang topic na i-discuss natin din? Dengue. Okay. So ingat na lang kasi ngayon June, dumadami na rin dengue. But at the moment, pag meron kang mga upper respiratory tract infection, it's still COVID until proven otherwise. No?
Doc, there's a question from Rochelle.
Nasaan?
Chat ba at chat ba?
Bakit mas critical daw po ang dengue pag nawala na ang fever?
Okay. Hindi naman absolutely hindi naman absolutely true yan na ano. Pag bumaba ang fever, it means baka nagre-recover ka na, no? Pero usually yung mga onset ng mga hemorrhagic symptoms nagsiset in during the time of the nawawala na yung fever, no? Okay. Just like in COVID usually yung fever sandali lang eh. Ang natitira palagi yung cough and colds, di ba? Ang tagal ng cough and colds, di ba? Yung fever sandali lang eh. Ganun din sa dengue, usually yung first 2 to 7 days, even lesser, bumababa na yung fever, it can mean that you are recovering already totally, or baka mag-set in yung mga critical events like bleeding, na i-observe mo pa rin sarili mo, na okay. Okay, I hope I have answered your questions, na. So hindi porke nawala yung fever mo that will cause the criticality of the dengue, na. Okay. Okay. So kung wala na, just remember, if you have cough and colds and fever at the moment, you still think of COVID-19 pa rin, no? Kahit na walang test, no? Suspect COVID pa rin, hindi flu, ha? Okay. The moment you have bleeding already, no? May rashes ka na, dengue na isipin mo, no? Okay?
Dengue.
Okay. There are no more questions. May question ka ba, Perla?
Wala na, Doc.
Okay. If there are no more questions, we call it a day. So we will, the next topic, okay, baka prostate awareness month, no? Prostate. So although majority of our attendees here are babae, pero this might be useful for your relatives, na mga prostate. Kasi June is still prostate cancer consciousness month, na. Okay. So habol ko lang yung prostate, na. Okay. So with that, we end our pep talk today. We'll hope to see you next week again. Okay. Bye-bye.
Thank you po, Doc.
Thank you, Doc.
Bye.
Thank you po.
Thank you.
Bye.
Dr. Ray.